Hi YouTube. I don't know how you vloggers do it. This is like my 20th attempt to make this video. Between people walking in, things stopping, me forgetting what I was going to say for 30 seconds. It's very hard. All the props to you guys. As the title suggests, this is a video about plastic surgery and plastic surgery in the Dominican Republic in particular, and obviously my relation to interest in this topic. And I wanted to make this video because I noticed in discussions about this in the outer net, typically, where I don't like to go, but I have to go there sometimes. I kept having the same interactions with people and getting the same questions, which seemed, some of them seemed kind of reasonable, some of them seemed illogical, some of them seemed like borderline xenophobic. So I just wanted to discuss this because, whenever something kind of gets attention or press, it's something that makes people say, like, oh, vanity. So, yeah, I wanted to go into that. Like, people ask why I'm interested in it. So, the answer to that question is that my kids are teenagers now, and as soon as I was done having kids, I knew that I wanted to do this eventually. That was before this was a procedure. So my procedure is the mommy makeover. I won't go too much into the details because it's not really that interesting, unless it's somebody probably who is looking into the same things. Very few people will be interested in that. So, yeah, I do. And another thing people say is, do you hate your body? Do you have some kind of dysmorphia? Is this an extreme thing to do? I think it's very extreme. I get my eyelashes done, so I don't have to wear mascara. A lot of the time I wear hair extensions because I like to have very, very long hair. I'm not wearing them now in preparation for my surgery, but they make me very happy. They don't make me look very different. I'm the same person. I just don't think it's a big deal aesthetically. Surgically, in general, surgery is, it's a serious step to take, and I don't take it lightly, and I don't think anybody who is on this journey does. I think that's another misconception, is that people think, patients don't know their risks, or don't care about the risks, or they prioritize vanity over everything else. And I don't think that's the case. I think most people are very similar to me in that, they're happy, they just want to change a few things. We'll all live if we don't do it, but it's something that'll make us happy, and I don't think that that's, horrible vanity. And another reason I wanted to make a video in particular is because I see a lot of videos discussing things, people trying to give information. I saw a popular YouTube vlogger did a very good, very long video, and she went into all the Brazilian butt lift or Dominican butt lift, I might call it a Sicilian butt lift, videos and questions, and she did a great job, but that's one video, and that's one person, and a lot of people keep this quiet, and I just, if it's your business that's private, that's fine, but I don't think it should have to be that way, and I think people will need support, so, or they need help answering questions, so I wanted to go into that. Another thing I hear a lot, usually if I discuss this in person with somebody, is they're kind of shocked or they think it sounds unsafe and scary. I think that's a kind of visceral reaction. Americans tend to think what we have is the best in the whole world. And we have a lot of good things in America, but America is not the world. And, it's not the case that everything outside of America is dangerous or scary or subpar or any of those things. So the Dominican Republic is a very popular destination for surgery, and almost always, especially for American plastic surgeons, I see them framing it as a decision of cost. Like, oh, well, it's cut rate, bargain basement surgery. And I can tell you from talking to a lot of people who are in the middle of, planning this, doing this, experiencing this, cost is not the reason why people go to the Dominican Republic. It has to do with the style of surgery that they do and their outcomes. And very early on in this process, I consulted with American surgeons. I, saw their work, and it's not that I wasn't impressed per se. It's just that if you're going through this and taking these steps, you kind of want to get as close to the goals that you have as you possibly can. So, they don't seem to work with the same aesthetic values that the surgeons in the Dominican Republic do. People also, in regards to safety, they'll point to adverse incidents, and there have been adverse incidents there. There have been some high-profile ones. There have been adverse incidents here. I have tried, obviously, being the type of person I am and doing the types of things that I do, I've tried to nail down numbers to see if there was a rate I could get close to. What is the rate here versus the rate there of complications, of mortality, and, you hear about an incident here or there, an incident in Miami, but that doesn't tell us anything about a rate. So that's not a number we have, but the fact that we don't have it, I think is the start of a good sign, because if it was an extremely common thing for somebody to, if there was a very high mortality rate, we'd probably know what that rate was. And we don't, and I'm not saying that doesn't mean that the rate isn't higher there. I'm just saying that it's not easily accessible. Even doctors who are very opposed to Americans traveling for surgery don't really have those statistics at the ready. And people have asked me things like, people always want to know who your surgeon is, because there's a whole community of people, they typically refer to themselves as dolls, and there's a whole community of dolls, and pretty soon they pick a surgeon, and there are sub-communities for each surgeon. So people ask you who your surgeon is. My surgeon is Dr. Lima Vargas, who I picked because he's an extremely nice person. His coordinator is very nice, very knowledgeable. He hasn't had adverse incidents. Nothing that I would rate major. I've only seen one halfway complaint about him, but it was based on inaccurate information. So I've checked and checked and checked and checked, and this is the surgeon that I was drawn to the most. And everybody who's picked a surgeon typically feels that way. Dr. Yili de los Santos has a big fan base, and her patients they have their hearts set on seeing her. Dr. Cabral is very popular, slightly controversial, but the girls who want to go see him will go see him. So Dr. Lima is my doctor. I really just knew from the start that was the doctor I wanted. I don't really know why. There's just some kind of vibe that I got off him that made me feel very safe and not like I would be lost among a million patients. I've had people ask me, is he a doctor? Yes, he's a doctor. Is he a surgeon? Yes, he's a surgeon. Is he board certified? Yes, he is. There is a body in the Dominican Republic, Soto Cipre, I believe it's called, and I looked him up. He is certified. He's a surgeon, just like the surgeon here. So yeah, that was, I wrote everything down, so I'm just looking at my notes. Yeah, Dr. Lima is the doctor that I think had the best mix of amazing outcomes, and he's really talented. And, safety. He's not working in a hospital where you're jammed in a room with 100 other girls waiting 12 hours for surgery, which is not something that I would like to do. So, there was no other choice for me. That was who I was going with. People also ask me if I have a will, which is a creepy question. I'll make one if you stop asking me that. Okay. So people ask, why didn't I go in the U.S.? Why couldn't I find a surgeon here? If it's not about money, why would I go to the Dominican Republic? And I would go back to results. I've looked through hours and hours worth of research. I've looked at pictures, reviews, different kinds of information, just anything that I could find. And there are some divisions among people who are in surgery groups and surgery forums, and the people who are anti-traveling and they say that it's risky and dangerous and horrible, and the people that are pro-traveling who say that American surgeons don't really do curves as well. And that was really it for me, was that too much of the outcomes, too many of the outcomes I saw here, women were kind of straight up and down. They didn't have a really nice defined waistline, and that was a big deal for me. Just kind of having the feminine look that Dominican surgeons sculpt. So that was the primary reason for me. I could go here if I wanted to, but I just couldn't find a surgeon here that I trusted, felt comfortable with, or who delivered even like half the results that I was seeing coming out of the Dominican Republic. So that was the reasoning behind that for me. And I want to go back again to the thing where people think it's about money, because I know a lot of women who are in this process, and money almost never comes up. Everybody's willing to invest in this, commitment to their future body, and they're not looking to save money. They buy a lot of pre-surgical stuff, a lot of post-operative stuff, and it's not a decision people take lightly or try to cheap out on. There are cheap surgeons in Miami who you would come out to the same going to Miami if you really are just trying to save money. That's where you're going to go. It's going to be Miami, and none of the surgeons I saw in Miami are doing the same sort of work. So that was that for me. And then another thing that I've heard people say to me is like, oh, isn't it really tragic that women can't just be comfortable with themselves and love their bodies? And I get where you're coming from, but, I think part of being comfortable and loving your body is being willing to make the changes to it that you want to make, which leads me to another question I didn't write down. People are like, have you tried going on a diet first? None of these procedures at the Mommy Makeover are weight loss surgery. It has nothing to do with weight loss at all. And that's kind of a frustrating question, because it shows a fundamental lack of understanding about the surgeries involved. They do not cause you to lose weight. They may recontour your body in a flattering way, but you can't go into a surgery and that's just not how it works on any level. That's not, just get that idea out of your head. And don't say that to people, because A, you're tacitly calling them fat, and B, it's frustrating to this person that you don't know what you're talking about and you're trying to give them advice they probably haven't asked you for. So that is a thing. Don't do that. And if you've heard that and you're watching this because you're looking for somebody else who is in the whole journey thing, I'm sorry that happened to you. So yes, feminism and, body positivity, I don't think these things are mutually exclusive. I like my body the way it is. I like all of me the way that I am, but this is something I've wanted to do for a long time. It's not because I dislike my body, it's just because these are changes I want to make to it. Like, if I paint my living room, it's not because I dislike my living room, I'm just putting a different color on it, and that's kind of how I look at it. So, yeah, that was the next question I had written down. Do you hate your body? Because a lot of people who, a lot of people are secretive about this, and I can see why. The kind of position I'm in my life, it's not really beneficial to have secrets, but I'm also not a secretive person. So you can ask me anything. If it's something I don't really want to say in a public space, I might answer it privately. But yeah, that's... I don't think it's silly if you want to be private about it, but I just think that in general, the idea that there's anything wrong about it, where it's very much different from getting a haircut in terms of, secrecy, is strange to me. I wanted to go into also preparation, because when you're seeing a surgeon elsewhere and you have to travel, there's some pre-care and post-care things you can't do. So I'm doing that green smoothie thing, not because I believe that you can detox. I don't believe in any of that garbage. It's mainly because I'm trying to eat as much spinach and iron heavy stuff as possible. I take this. It's this weird, old tonic stuff that, I had to get off of Amazon. And I take standard prenatal vitamins, just to make sure that I am in a good place to get surgery before my surgery happens. So my surgery's in less than a month. Yay, I'm very excited. I plan to work while I'm recovering. I'm going to be there for 10 days. Another thing that people are interested in learning about or hearing about is the process of, and it varies from doctor to doctor, but generally depending on your doctor, with my surgeon, he works closely with his coordinator, Janet, who is an amazing woman. Everything you hear and read about her is true. She's very caring. One night I posted in our Facebook group about my mom having some discomfort about my decision to do this, and it was 11 o'clock at night after a long day, and she made sure she got in contact with me, even though I wasn't addressing it to her, and she said, let me talk to your mom, I'll make her feel better. And, this is not something she has to do. She could just close her laptop and go to bed, but she didn't. That's what Janet's like, and I feel very safe going to her. She manages a recovery house linked with Dr. Lima's surgery. It's called Janet Deschamps International Recovery House. The reviews are also excellent. It's staffed by nurses. They do all the cooking, and all you have to do is recover while you're there. So from the mom side, I'm also kind of looking forward to a vacation. Not that it's going to be much like a normal vacation, because I'm going to be recovering from a surgery and all that, but it is the first time, and I can't remember how long, that I have a long period of time to just kind of chill out, do some work stuff, and, just relax, even if it's going to be slightly uncomfortable. Back to things you might need to do if you're getting a Brazilian butt lift or a Sicilian butt lift. I think I want to try to make that stick. They say to get a pillow. I am skeptical that the boppy will work for the sitting thing. Maybe another video at a different time. I've seen a lot of surgery woo going on, which obviously will get to me on a kind of I don't like woo level. But Brazilian butt lifts are, they're delicate. You should probably get a pillow. I've been looking to buy one, so yeah, that's, you need a faja. I know American surgeons and American patients don't seem to use them. I don't know that you need to wear it for a year, but I do think that you should listen to your surgeon, and it sounds as if your body will tell you how long you should wear the faja for, so I'm looking at maybe 6 months. I just want to make sure I optimize my results. Back to procedural, so for me and for all of Dr. Lima's patients, as I understand it, I'm landing there and somebody's going to come from the recovery house to pick me up. So I don't have to navigate past the airport on my own. And the first day that I get there, you should never operate on a first day. No surgeon is likely to operate on a first day when you get there because of the risk of blood clots. So the first day I have to do pre-surgical testing, and I'm the most nervous about that because you really don't know what's going on with your blood or your heartbeat or your blood pressure or those things. You can go to the doctor, but on the day you land, you don't know what you're going to be like. So I'm nervous about passing my labs because I am very excited about my surgery. And then you go to bed and somehow try to sleep. And then the next day, usually your surgery is booked. So I'm hoping that I'll be first on that day because I am very excited, and also because I can't imagine waiting hours. I would be so anxious by the time it got to be my turn. So I know that that in some places like Cipla, from what I understand, you can get there at 6 in the morning, get operated on at midnight, and that terrifies me. I've had nightmares about it. And then, for the next 9 days, there are some massages involved. From what I understand, they are helpful in the beginning, but again, I've seen people talk about getting them for months. I don't know that that's necessary. There's, you wear drains if you have a tummy tuck or, some other surgeries that I'm not necessarily familiar with involve drains. People always want to get them out as soon as possible. I know that they're probably really uncomfortable, but I would recommend trying to stick it out because early drain removal can lead to seromas, and you don't want stuff like that, especially if you're traveling and you don't know for sure how good your care is going to be when you get back. So that part, I think, those are definitely steps you can take to minimize your problems or, any aftercare when you get home. The advice that I've gotten from Janet in terms of packing and what you need, she said not to overpack, and I can see how that would be a massive problem. If you're overpacking, you're going to be still recovering when you come back. You have to carry all this stuff, so I'm only bringing a few outfits, and not a faja. I'm going to get one when I'm there because I don't know what I'm going to need. And I'm bringing some, some long dresses that are comfortable and flip-flops that are comfortable, the yoga mat ones. I like the Crocs Athens, but they're like out of production now, so I had to get the yoga mat ones. And some sleep shirts, and that's about it because I don't want to be lugging stuff through the airport. Oh, get wheelchair service on the way back. That is supposed to be really important. I've never done this, so I'll tell you how important it is when I'm on the other side, but it makes sense. I have a hard time lugging stuff in the airport when I'm not just after having surgery, so definitely don't forget that. So this video is kind of primary and disjointed. I had hoped to go a little more in order, but hopefully I'll make some more video vlogs and answer some questions. I just feel like I see a lot of dolls getting abused, getting criticized for this decision, getting class shamed. I think there's a cultural divide here, and I just wanted to speak up and, talk about the why of this and explain why I'm personally doing it, why I made the choices I did, why somebody who is intelligent and who is aware of things might, consider this not to be as big of a risk as it's made out to be. I wanted to destigmatize it a little bit. I wanted to just kind of open it up so more people feel comfortable talking about it. And I also want to share the things that I find out. So, it's been hard for me to find information. I don't want other people to find it as hard. So, if you have any questions, this is my first real YouTube video. Leave them in the comments. If you want me to look something up for you or try to find something out, please ask me. I love doing research. If you feel lonely or if you're going through this and you don't want to make a video, definitely leave a comment. And thank you for watching my video, and hopefully I'll update you with some actual useful information in the future.